Getting to the end of treatment is a milestone on the cancer journey. You probably imagined what it would be like, feeling excited, getting back to normal. But for many cancer survivors, the reality looks and feels different. Emotions like sadness, anger, worry, and guilt are common after treatment ends. These emotions can be unexpected and confusing, especially if people around you are telling you to be happy and move on with your life. You may even feel disappointed in yourself for not feeling or acting in ways you or others expected. One of the big misconceptions about cancer is that when treatment ends, life returns to normal. In fact, the recovery process is just beginning. If you think of cancer as an earthquake, being a cancer survivor is about dealing with the emotional aftershocks. When cancer treatment ends, feelings like worry, sadness, and anger not only don't go away, they may seem more intense than they did during treatment. Often these emotions are signs of grief over the losses that happened because of cancer. Loss of health, loss of body parts or functions, loss of job or finances, loss of life as it was. It's also common to feel lonely after cancer treatment ends. Friends and family who rallied around you during treatment move on with their lives. You may even feel guilty that you survived cancer when others you know didn't or likely won't. All of these emotions are normal, but they're not easy to deal with. What can help? Here are some strategies to explore as you navigate life after cancer treatment. Remind yourself that it's okay to feel whatever you feel. Feeling sad, angry, or worried after cancer treatment ends doesn't mean you're ungrateful, weak, or broken. Your feelings are valid and tell you something about how the cancer experience and its aftershocks are still affecting you. Remind yourself that it takes time to adjust to life after cancer. Talk about it. It's important to talk about your thoughts and feelings, even if it's hard. Sharing your feelings with trusted friends or family members may help. When the emotional aftershocks of cancer feel hard to manage, consider talking to a counselor or joining a support group for cancer survivors. Sharing your experiences and learning from those who have been there can be invaluable. Face forward, not backward. How often have you thought, I want my old life back, or I miss the person I was before cancer? Accepting that things are as they are now and that you'll never be exactly the person you were before cancer may help you face forward to the future rather than back at the past. Acknowledge what your body has gone through and try to focus on doing things that will help you feel the best you can going forward. Take control of what you can. So much about dealing with cancer is out of one's control, but there are things you can control, like how you take care of your body and adapt to the ways it has changed, how you treat yourself and others, and how you connect to the things that are important to you. Focusing on the things you do have control over can be one of the keys to coping in the aftermath of cancer. Find meaning in your experience. After treatment ends, you may find yourself asking questions like, why did this happen? What's the point? Or what do I do now? Reflecting on what you learned about yourself during cancer treatment and how you want to care for yourself and others going forward can lead to growth. When we're able to learn something from a traumatic event or find meaning in a difficult experience, it can help soften the hard parts of that experience. None of these strategies are quick or easy to do. Dealing with the emotional aftershocks of cancer is challenging, and it takes time.